We'll talk a little bit about the articular cartilage of the coffin joint. It's an area which I think is probably one of the most useful things, because this really is virtually impossible to see in any other way, but it's a difficult structure to look at. In the coffin joint, we've got some of the thickest cartilage actually that we have in the distal limb, and it's still problematic because we rely really on being able to differentiate it from the subchondral bone beneath it and the joint fluid, separating the two areas of the joint here. So we've got the high signal cartilage, the low signal joint fluid, and then cartilage the other side. So we can clearly define it from the subchondral bone, and we can usually define it from the synovial tissue, from the synovial fluid, but sometimes if the joints are opposing, the surfaces are opposing, then we lose the ability to see that. So we rely really on the fluid delineating where the cartilage is. But horses which have developing cartilage disease, we detect it by seeing low signal on certain sequences where cartilage should be high signal. So these aren't difficult to diagnose, these are easy cases. These have got advanced cartilage pathology, and you can see these very low signal patches within the cartilage here. Now that can represent a number of different things. So the low signal itself doesn't necessarily mean that there's a cartilage erosion. It can mean that there is mineralization in the cartilage, which is part of the degenerative process of cartilage. So we can see that if the cartilage is mineralizing, then it's the biomechanics are changing. It will be susceptible to fissuring, fibrillation, all these things. There can also be artifacts that can cause that appearance, but they're pretty consistent, so you can usually pick those up without too much difficulty. When we see it in combination, particularly with joint modelling, so osteophytosis of the margins of the joint or subchondral changes, then we can be pretty certain that it's there. And it's only with those very thin slices that you can find this. That's why you've got to strive to get the horse to stand still and to get the nice images. So it's a little bit controversial, cartilage imaging. For anybody that knows anything about MRI, it's very controversial and hot topics, even in people using very high field magnets like 7 Tesla magnets and things, because it's difficult, and it's as simple as that, and it's quite difficult on our system. So we looked at when we had this appearance. So here we've got, this is the medial side of the joint, so the horse tends to lean and the joint surfaces oppose here. These areas of low signal, these little irregular subchondral areas there, we saw those quite regularly, and sometimes wondered if they were real or not. And with having a CT machine, we've been able to try and replicate these lesions using intra-articular contrast to actually see that these are true areas of cartilage disease. So being able to put those two things up together, you don't have to do that in every horse, but if you do it in some horses, then you'll soon get the idea of what is real and what isn't real. And it does correlate well. When you have this type of appearance on a low field image, you can be quite certain really that there is a problem there, and some people would disagree with that, but it depends on how thorough you've been sort of investigating if that's true or not, I think. And these tiny little lesions here, this is a fissure on the articular surface of P3 here, and if you really get your slices nice and thin, you can even detect these tiny fissures here. How relevant they are to the lameness is another matter, but what we need to do is be able to know exactly what's going on. The downside is that there are some cases which are, even though this is a horse with quite bad articular cartilage, some cases can be hard to detect. So if you've got a large horse that won't stand very well, you can often get the appearance of absolutely normal cartilage because you can see the layers, and this type of pathology can be going on and you will have no idea about it. And these horses don't always block very quickly anyway to a coffin joint block. So we have been caught out a number of times with quite advanced cartilage disease with relatively normal looking MRI findings. So that is a differential diagnosis for a normal MRI scan in a horse that blocks to that region. It gets much easier when we've got subchondral bone changes, and these are quite common. This is quite a common appearance to horses with more advanced osteoarthritis of the coffin joint. You get the condyles and modelling because they're pathologic and they're changing shape, and then this can tell us quite nicely that there is problems developing there. Now this is, you will see cartilage disease of some form in almost every horse that you MRI scan, and that's why it becomes very important to decide what's relevant and what isn't. It's also very useful, as we've spoken about a little bit already, but I say the ligaments and the cartilages of the foot, because what's become apparent over the thousands of horses that have been MRI'd now is that what we once thought we looked for collateral ligament injuries and tick that box if it had one or not. There was a lot of confusion in the early days because of artifacts that arise in these ligaments, and now we know it's actually even more complicated than we thought. But these collateral ligaments, so this is the collateral ligament here, this is a transverse slice, so that's P2 here, this is the proximal part of the collateral ligaments here and here, and you can see how closely associated they are with the collateral cartilages and the ligaments that support the collateral cartilages. And this is a horse with an active side bone injury here, so that's a degenerative collateral cartilage. And all of those structures do function together. It's important to remember that. They're not just simple structures which we can say it's either this or it's that. They're often all involved. So they're the types of quite complicated horses which we do struggle with when they start getting combinations of ligament injuries and collateral cartilage injuries. They can be difficult to get sound. And it tricks us really, because on an X-ray you just see a bit of side bone and you think, well, that's not very exciting, let's send it for an MRI scan, and then we come back to you and say, well, actually the side bone is relevant, but not just the side bone, but all those ligaments that support that area.